I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia, and this is VEC Vaccine Notes. Today we're going to talk about influenza, which most people call the flu. Now, although that name is fairly common, it also leads to some misconceptions, and we'll get into that a little bit later. But first, just kind of outline what we're planning to do today. We're going to talk about the disease and the virus that causes it, the vaccines that are available. We'll go through some common questions we get here at the Vaccine Education Center, and then we'll finish up with a look at the relative risks and benefits. Now, most people would actually probably be surprised to know that influenza kills thousands to tens of thousands of people every single year in the United States. These deaths don't make headlines, so most people aren't aware that they're happening, but they do happen. And if there's a pandemic, those numbers of deaths can increase even more. We'll talk about the difference between yearly epidemics and pandemics as we go along here today, but know that pandemics are much more deadly. As an example, the 1918 influenza pandemic was estimated to kill between 50 and 100 million people just in a single influenza season. So what is influenza? Influenza is a virus that infects our windpipe and breathing tubes. The symptoms can start so quickly and be so dramatic that people often remember exactly when they started feeling sick. Symptoms typically include shaking chills, severe muscle aches, a high fever, and a headache. Those symptoms will last a few days and then they'll resolve, but people usually also have a runny nose and a cough that can last for weeks. Now, complications from influenza also exist, and they can include pneumonia, encephalitis, which is an inflammation of the brain, and Guillain-Barré syndrome, or GBS, which is a syndrome in which the immune system of a person attacks their nervous system. We'll talk a little bit more about GBS as we go along here today. Another thing that can happen from influenza is back-to-back infections. So what happens is the body is weakened by influenza infection, and then another, often bacterial infection, will come along right after. So it's actually a second pathogen that's basically being opportunistic and using the fact that your body is weakened from the influenza infection to cause its own illness. Medically, this is called a secondary infection. And what's important to know about secondary infections is that they wouldn't happen typically if the first infection hadn't occurred. So the two infections are related in that way. For influenza, a secondary infection that's very common among the elderly is pneumococcal infections. Now, influenza virus spreads from person to person through respiratory droplets, so most often through coughing and sneezing. But if the virus is laying on a surface and somebody touches that surface and then they touch their eyes, nose, or mouth, they can also infect themselves with the virus that way. Influenza virus can infect several different kinds of animals, including common household pets like cats and dogs, as well as farm animals like pigs and cattle. And there are two important things to know about this ability of influenza to infect other animals. First, if a person is working close to an animal that's infected with influenza virus, they may be able to get infected with influenza themselves. We've heard about this in the news during 2024 and 2025 with the H5N1 virus that's been infecting dairy cattle, and then some farm workers have been getting exposed to the virus and becoming ill from it. We have more information about that on our website, so you can definitely check that there. And we also have a more comprehensive list of the kinds of animals that influenza virus can infect. The second thing to know about the fact that influenza virus infects animals is that if an animal is infected with two different kinds of influenza virus at the same time, those two influenza viruses can mix to create a brand new virus. And this is what sets the stage for a pandemic. Now, a pandemic is a worldwide epidemic. An epidemic is what we see every year when influenza passes through communities. And during the annual epidemics, some people have immunity, so everybody isn't going to get sick. But if there's a new virus, then a pandemic can occur, and everybody is susceptible to that new virus. And that's why it's such an emergency when a pandemic occurs. Now, a new virus would have to have 3 characteristics in order to cause a pandemic, and it's rare that this happens, but it can occur. The new virus would have to infect people, it would have to spread from person to person, and it would have to cause an illness in people. And if the new virus does those 3 things, then the stage is set for a pandemic. We've had several pandemics during the last few centuries, and we have the list of when those occurred on our website. We also have a video clip about Dr. Maurice Hilleman, who in 1957 realized that an influenza pandemic had started in Asia, and he was able to gather resources to create a vaccine so that by the time the virus reached the United States in the fall, we could protect some of our country's population with the vaccine that he was able to make. So definitely check that clip out if you're interested in learning more. Now let's talk about the influenza vaccine. Virtually everyone 6 months of age and older is recommended to get 1 dose of influenza vaccine every year. The exception is children getting their influenza vaccine for the first time. They usually need 2 doses separated by a month. Now, there are 2 points related to the timing for those children receiving their first influenza vaccine. First, even if the child doesn't get their second dose within a month, it's recommended to try to get that second dose within the same season. Otherwise, they may need 2 doses the following season when they go back for their vaccine the next year. Second, if the child is receiving their first influenza vaccine and they're at least 8 years of age, then they probably are only going to need 1 dose, and that's because it's assumed they have some immunity to influenza by that time. Now, some people wonder, when should they get an influenza vaccine? And for most people, early in the fall, such as September or October, is the recommended time frame, preferably before influenza starts circulating in your community, because it does take about 2 weeks to gain immunity after getting vaccinated. But there are a few groups who can benefit from getting the vaccine earlier in the season if it's available. The first is that group of children who need 2 doses, as we just talked about, simply because they have that 4-week period between doses, and it's only after the second dose that we can figure that they're protected from influenza. Another group that could benefit from getting the vaccine earlier if it's available are pregnant women who are in their 3rd trimester of pregnancy. And this is really to benefit the baby, because if the woman gets her influenza vaccine before she delivers, then the baby will have maternal antibodies that were boosted by that vaccination, and that can protect them during that first 6 months of life before they can get their own dose of vaccine. The third group that can conceivably get their dose of influenza vaccine earlier are young children, because they have a good immune response to the influenza vaccine. And particularly if they're coming in for a summer checkup and they might not be back in the office in the fall, you could consider getting them their influenza vaccine in the summer if the vaccine is available. Another note about influenza vaccine timing is that even if people don't get their influenza vaccine during September or October, they can often still benefit from getting it a little bit later in influenza season, particularly since influenza usually circulates in the United States through the spring. Now, there are 2 other notes about influenza vaccine that are worth mentioning at this juncture related to who should get vaccinated. One relates to people who have egg allergies, and a lot of people that have severe egg allergies are under the impression they cannot get the influenza vaccine, and that used to be the case. However, with improvements in technology, even people who have severe egg allergies are now recommended to get the influenza vaccine. There are some influenza vaccines that are made using an egg-free process. Even if the kind of vaccine that an egg-allergic person gets was made in eggs, the protein purification technologies that are currently available ensure that the quantities are so small that people are unlikely to have any kind of reaction. But as with any other vaccine, you should stay at your provider's office for 15 to 30 minutes after getting vaccinated in case you do have a reaction, because then there will be medical personnel available. The second note are people who have a history of Guillain-Barré syndrome, or GBS. We talked about the fact that that's a situation when the immune system attacks the nervous system. Influenza can cause Guillain-Barré syndrome. So there's some question as to whether the influenza vaccine can also cause Guillain-Barré syndrome, and the answer is yes, but rarely. So because of this, some people think that if they have a history of Guillain-Barré, and even some healthcare providers think that that person can't get an influenza vaccine. The reality is that there's a very specific time frame. If they were diagnosed with Guillain-Barré syndrome within 6 weeks of getting an influenza vaccine, then they shouldn't get an influenza vaccine. However, if they had Guillain-Barré syndrome at any other time, they can still benefit from getting vaccinated against influenza, particularly because people who get infected with influenza virus have a 17 times higher chance of getting Guillain-Barré than if they get vaccinated. Now let's talk about how influenza vaccines are made. We have several options available in the United States. In all cases, they protect against 3 kinds of influenza, and the strains of influenza that are included are chosen each year because the virus does change a lot when it replicates, and the virus moves throughout the world. So actually, the strains that are used for our vaccines in the Northern Hemisphere are based on what strains circulated the previous season, but also what strains were circulating in the Southern Hemisphere. Now, some years, those vaccines are a better match than other years. So the different types that are available, there's the traditional one that most people think of for a flu vaccine, and that's where the influenza viruses are grown in eggs, and then they're purified and killed with a chemical called formaldehyde. That vaccine is given as a shot. Second type is very similar, except instead of growing the influenza virus in eggs, it's actually grown in mammalian cells, in this case, canine kidney cells. The viruses, again, are purified away from those cells and killed with formaldehyde and given as a shot. The third type uses recombinant DNA technology. So the scientists took one protein from influenza virus, it's called hemagglutinin, and it's on the surface of the virus. And they put the gene for that into cells that they grow in the lab. And as the cells reproduce, they also make this protein. The protein is then purified and given as a shot. The fourth type is not given as a shot. It's given as a nasal spray. And in this case, the virus is a live weakened virus. The technology here is pretty cool because what the scientists did was they altered the influenza virus so that it can grow at the temperature of the nose, but it can't grow at the warmer temperature in our lungs. In this way, the virus reproduces in our nose after we receive the nasal spray vaccine, creates immunity in the nose, and protects us from getting infected. In all cases, the virus is either dead or weakened, so it can't reproduce and cause an infection. So when people think they got flu from the flu vaccine, they're mistaken. If they have symptoms like the typical side effects of fever or muscle aches, that's their immune system responding to the vaccine. And when people get the nasal spray vaccine, they sometimes will have a runny nose and congestion. So those are the side effects from that vaccine. Now, some of these vaccines are available in different doses for different age groups, and your healthcare provider will be sure to be giving you the correct dose for your age. There are some high-dose versions available for the elderly. And in 2025-2026 influenza season, for the first time, the intranasal or the nasal spray vaccine is supposed to be available for at-home use. This is called FluMist Home. We have some more information about this on our webpage, vaccine.chop.edu, and you can find out more or watch for our announcements, as I'm sure you'll be hearing more about that. We're taping this in July of 2025. So as we get closer to influenza vaccine season, you'll likely hear more about that vaccine. We also have information on our influenza webpage about the ingredients that are contained in influenza vaccines. The only thing I'll say related to influenza vaccine ingredients at the moment is to note that none of the influenza vaccines are made using human fetal cells. This is a rumor that has spread in the past, but it doesn't apply to influenza vaccines. Now let's address some of the common questions we receive here at the Vaccine Education Center. Sometimes people wonder, what is the difference between winter viruses, flu, and common cold? And this gets at that misconception I mentioned earlier. Because a lot of these, particularly respiratory viruses, appear in the winter, they can be mixed up with influenza. So if you think about the holidays and the winter time, we're often seeing more people. We're hanging out indoors. We're seeing different people than we normally would see. And so that sets the stage for us to share our viruses. And there are a lot of viruses that are readily shared. And people will often say, I have the flu, when in fact they may not have influenza. So people will think they have influenza when really they just have one of these other viruses. There are two common sets of symptoms that are associated with influenza, and then many other viruses that also offer these same symptoms when they occur. So there are respiratory symptoms like congestion, runny nose, coughing, sneezing, sore throat. And then there are gastrointestinal symptoms like nausea, vomiting, and diarrhea. And there are a slew of different viruses that cause these in addition to influenza. One example is rhinoviruses. Rhinoviruses are responsible for the common cold, and there are over 100 different rhinoviruses alone. There are also adenoviruses, enteroviruses, human coronaviruses. We have a comprehensive list of different kinds of viruses that cause these symptoms on our webpage at vaccine.chop.edu. What's important to realize, however, is that when someone says they have the flu, they may or may not actually have the flu. And to extend that point, they may say, I got the flu vaccine and I still got the flu. And it's important to remember that maybe they did get the flu vaccine and maybe they did get infected with influenza, because we know that the vaccine isn't perfect. But it's also likely that if they didn't go to the doctor and they're just basing their assumptions on their symptoms, that they may have had one of these other many viruses. We only have vaccines against 4 of these hundreds of viruses: influenza, rotavirus, respiratory syncytial virus, or RSV, and COVID-19. So if there are hundreds of viruses and we only have vaccines against 4, you can do the math. What we need to do to protect ourselves against many of these are the things that we try to do throughout the winter anyway: washing our hands, covering our coughs, cleaning surfaces, staying home when we're sick, all of those kinds of things. Those aren't foolproof, but they're the best we can do when we don't have vaccines. Some people wonder whether you can get Guillain-Barré syndrome from the influenza vaccine. Guillain-Barré syndrome is an autoimmune condition in which your immune system attacks your nervous system cells. It is true that on rare occasions, people can get GBS after having the influenza vaccine. However, it's much more likely that someone will get GBS after having an influenza infection. In fact, it's 17 times more likely to get GBS after an influenza infection than after an influenza vaccine. The other thing to remember when you're thinking about the relative risks and benefits of getting vaccinated versus taking your chances of getting the disease is that people die from influenza every year. As we mentioned, thousands to tens of thousands of people in the United States die every single year from influenza. And that includes children, previously healthy children. The average is 75 to 150 children per year who die from influenza infections in the United States. But some years are worse than others, and we can't anticipate when those years will happen. For example, in 2024-2025, 260 children died from influenza. And 9 out of 10 of those children had not received an influenza vaccine. So while GBS after an influenza vaccine may feel scary, it's important to remember that your risk is greater if you get infected with the virus, and the virus can also be deadly. Some people ask, why do I get the flu if I had my influenza vaccine? We've alluded to a couple of the reasons here, but let's go through it. First, as we mentioned, there are hundreds of different viruses that cause flu-like symptoms. So some people will say they have the flu when they actually have some other infection other than influenza virus. Second, the virus changes as it replicates. In some years, the vaccine is a better match than other years. We know the influenza vaccine isn't perfect, but it's still better than having no vaccine. And hopefully someday we'll get a vaccine that doesn't need to be changed annually and works better. Third, it takes about 2 weeks between when you get the vaccine and when your protective immunity develops. So if you're exposed to the virus, especially if you get vaccinated while the virus is circulating in your community, you could be exposed before the vaccine had a chance to develop your immune response. Now, with all of this said, it's still important to remember that getting vaccinated is still the better choice because it gives you some specific protective immunity as opposed to the things we do to try to keep ourselves healthy, like washing our hands and cleaning our surfaces. But second, if you got the influenza vaccine and you do develop influenza, chances are your case is going to be less severe and of shorter length. So it's still worth getting the vaccine to offer yourself the best protection that we have available. Sometimes people write to us and ask whether they should get the influenza vaccine if they're pregnant. The short answer to this question is yes, but let's take a deeper look. When people are pregnant, their bodies undergo physical changes, such as having higher blood volume and having more pressure on their heart and lungs. And those physical changes make them more susceptible to having severe influenza or complications of influenza. In fact, a pregnant person is more likely to be hospitalized if infected with influenza compared with someone of the same age who's not pregnant. So it's important to get the influenza vaccine to protect themselves. The second reason to get the influenza vaccine is to protect the baby. Because remember, babies can't get their influenza vaccine until they're 6 months of age. So if someone's vaccinated during pregnancy, their own antibodies will be increased. Their own influenza-specific antibodies will be increased, and they will be passed to the baby. These are called maternal antibodies. And when the baby's born, they'll have maternal antibodies for a few months after birth. So especially if the baby's going to be born during influenza season, this is a good way to offer them some protection until they're old enough to get their own vaccine. Some people ask us what they should do if someone in their home is diagnosed with influenza. It's important to know that most people, whether they're vaccinated or not, will have mild symptoms if they're infected with influenza. So in that case, they can just stay home and get rest, drink plenty of fluids, and stay away from other people until they're fever-free for about 24 hours. Now, there are some people that are at higher risk for severe influenza. And for those people, if they think they are infected with influenza, it might be beneficial to seek early medical care. And that's because there are some antivirals that they might be able to take that would help to shorten their severity and length of disease. But it depends on the timing. Those antivirals tend to work mostly if they're given right at the very beginning of infection. The high-risk groups include young children under 5 years of age, particularly those less than 2 years of age, pregnant people, the elderly, 65 and older, as well as people with chronic conditions, either children or adults, who have chronic conditions of the heart, immune system, lungs, or kidneys. Now, with that said, it is possible for anyone to have severe influenza that can cause hospitalization or even death. So there are emergency symptoms to watch for, regardless of somebody's baseline health situation. In infants, the emergency signs to watch for include being unable to eat, having trouble breathing, or having signs of dehydration, such as not producing tears when they cry, or having significantly fewer wet diapers than normal. For children, emergency signals include fast or labored breathing, having a bluish color to their skin, not drinking fluids, not wanting to wake up or interact with others, being so irritable that they don't want to be held, having a fever with rash, or having flu-like symptoms that improve but then return with a fever or worsening cough. If you're caring for adults, you want to monitor for difficulty breathing or shortness of breath, pain or pressure in their chest or abdomen, sudden dizziness, confusion, severe or persistent vomiting, or having flu-like symptoms that improve but then return with fever or worsening cough. Sometimes people wonder, since influenza is a virus, what treatments are available if they would seek any. So the first thing a provider will usually do is try to confirm that the person has influenza. And there's a test called a rapid flu test. It's done by taking a sample from a nasal swab, and usually you get the results within about 15 minutes. And that test looks to see if there's genetic material from influenza virus. Now, if you're confirmed to have influenza and it's early in your infection, you may be prescribed an antiviral medication. However, those usually only work if they're given early in the infection because of the way that they stop the virus. So usually within the first 48 hours, somebody can get an antiviral and it will be effective. If it's been longer than that, particularly because sometimes people don't feel that sick, but then they start to feel worse and they go for medical treatment, then the healthcare provider is probably going to be looking to see if you're having complications of influenza or a secondary infection, meaning an infection caused by another pathogen. And in those cases, the treatment that you would receive would be based on what exactly is happening, what symptoms you have, and how the provider can make you more comfortable. Some people wonder whether they're more susceptible to other infections when they have influenza. The short answer is yes. Basically, your immune system is busy with influenza virus and another pathogen, often a bacterial pathogen, will seize on the opportunity to also cause infection. With influenza virus, a common secondary or opportunistic infection is caused by pneumococcal bacteria. Pneumococcus is a bacteria that can cause pneumonia, among other complications. And we particularly see opportunistic or secondary infections with pneumococcal bacteria after influenza among the elderly. Now, we have vaccines for both influenza and for pneumococcal. People often refer to the pneumococcal vaccine as the pneumonia vaccine. While influenza is an annual vaccine, pneumococcal vaccine is not, but people, particularly the elderly, can benefit from having had both of those vaccines. Now, other viruses also can cause people to be more susceptible to secondary infections. Other examples you may have heard of is that when people have chickenpox, they're more likely to be infected with group A streptococcus, what's more commonly referred to as flesh-eating bacteria. And when people are infected with human immunodeficiency virus or HIV, they're more likely to also be infected with the bacteria that causes tuberculosis. A new question we've been getting is that people are starting to hear that they can get the nasal spray influenza vaccine at home during the 2025-2026 influenza season. And there is not a lot of information about that yet, but we do have a link to an article on our website that can give you more details about how that's going to work. So check out our website, vaccine.chop.edu, if you're interested in finding out more about this new at-home option called FluMist Home. People also ask about mercury in influenza vaccine. This refers to a mercury-based preservative called thimerosal that used to be used in many vaccines. It is no longer used in routinely recommended vaccines in the United States, including the influenza vaccine, but it is used in other countries. So let's talk about this related to influenza vaccine. Single-dose vials of influenza vaccine do not contain thimerosal. The multi-dose vials do. Now, there's two important things to realize about this mercury-based component in multi-dose vials of influenza vaccine. First, we know that the quantities have been studied extensively and found to be safe. The idea that mercury is in vaccines is one that provokes fear, but it's important to remember to listen for context. When you're talking about any chemical, including mercury, the dose makes the poison, meaning the amount that you're exposed to will determine whether or not you would have untoward effects. And in this case, we've studied this question, and we know that the amount of mercury, even when it was contained in more vaccines than it's currently contained in, was safe. Second, it's important to know why why mercury was in the vials of influenza vaccine or in other routinely recommended vaccines. Multi-dose vials of vaccine contain several doses. Let's say, for example, 10 doses of vaccine in a particular vial. That would mean that 10 times a needle is going to be stuck through the cap of that vial to draw up a vaccine dose. If the cap is not properly sterilized, when the needle punctures the cap, it can introduce bacteria into the vaccine. So for the dose that's being taken out for the individual at that time, there's no problem. But as that bacteria sit in the vaccine vial, it can replicate and contaminate the vial. So when future doses are taken out of the vial, somebody will not only be getting influenza vaccine, but they may be inadvertently getting bacterial contamination. This used to happen before thimerosal was used as a preservative, and that's why it was added to vaccines that were given in those kinds of vials. Now, that kind of contamination can lead to somebody developing a small sore on their skin at the site of the injection, but it can also lead to something else, which is bloodstream infections, and those can be deadly. So it really was something that was important to resolve when we used multi-dose vials. Now, in the United States, we've moved away from using multi-dose vials, and luckily we're in a country that has the resources to be able to do that in most cases. However, in other countries, multi-dose vials continue to be used, and thimerosal continues to be present. So it's still important to understand that the amount of mercury in vaccines is safe. If you're interested in finding out more about thimerosal and vaccines, we have a page on our website, vaccine.chop.edu, where you can find more information, specifically around the use of the mercury-containing preservative known as thimerosal. Okay, so let's finish up with a brief discussion about the relative risks and benefits of influenza. Today we talked about the fact that every year in the United States, thousands to tens of thousands of people die from influenza. We also talked about the fact that 75 to 150 of them are often children, some previously healthy children with no underlying conditions. And that there are some years that influenza is particularly harmful, such as in 2024-2025, when 260 children died from influenza. We know that there are groups of people who are particularly at risk, and we also know that people can have complications and can develop secondary infections. On the other hand, the influenza vaccine causes minor side effects, or in a case of GBS, which is a little bit more severe, we know that the risk of that is much, much less than if you would get an influenza infection. We also talked about the fact that people with egg allergies can usually get influenza vaccine, and that people who have a history of GBS can most often get an influenza vaccine unless their case was diagnosed within 6 weeks of getting an influenza vaccine previously. When our team evaluated the relative risks and benefits of getting this vaccine, we felt like the benefits of the vaccine outweighed the risks. And we hope that when you review this information, you'll feel that way too. Thanks for listening today.